this started out as one way to address the COVID-19 pandemic. But what we've seen is that not only do our public health needs change as we go through time, but also lots of communities are dealing with multiple public health crises at the same time. So, whether it's the opioid epidemic or youth mental health issues or health disparities in maternal and child health, there are many different issues that are facing our communities every day. And what we've seen already is that our Public Health AmeriCorps members are making a difference in their communities day in and day out. And maybe one of the things I'll say about Public Health AmeriCorps members is they are getting this really on the ground experience in the field of public health by doing this year of service. And our members don't need to have any experience.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all.
Hey friends, Happy New Year. So glad to be back and welcome to Public Health Careers. Super excited to be back talking with people, as well as I'm very excited for today's guest. AJ Pearlman JD is Director of Public Health AmeriCorps, where they are addressing the public health needs of our nation by advancing more equitable health outcomes for underserved communities and gain on-site experience for future careers in health and medicine. She's a result-driven healthcare policy and management professional with a proven ability to strategically set and achieve organizational goals and solve problems as they arise. Passionate about improving access to healthcare for all people, including children and youth, and developing future leaders to serve in social justice movements. AJ joined the AmeriCorps from the Department of Health and Human Services, where she served as the Chief of Staff for the COVID-19 response, leading efforts across the department to address and respond to the pandemic. And before this, she served as a health lead for the personal appointments team in the support of the Biden-Harris presidential transition. She conferred a bachelor's in psychology at the University of California, Los Angeles, and her Juris Doctor at Sandra Day O'Connor College of Law at Arizona State University. In today's episode, you'll hear and learn more about the role the Public Health AmeriCorps program has played in addressing the public health workforce challenges, its successes, and the challenges that come with it. You'll learn how all of us can advocate for the policies that we think are important to improve our community's health, as well as you'll hear about AJ working under Michelle Obama and being the Director for Policy for Let's Move at the Office of the First Lady at the White House. Additionally, you'll learn about the importance of representation and being in the room for policy decisions, and specifically when it came to the Affordable Care Act and queer communities. She's also going to share a lot about being Chief of Staff for the COVID-19 response and how non-linear a public health career path can look, as well as much, much more. Before we get to the episode, be sure to subscribe. Enjoy.
Hi, this is AJ Pearlman. I'm the Director of Public Health AmeriCorps, and you are listening to Public Health Careers.
AJ, welcome to the show. I'm super excited to be here with you today.
Thank you so much for having me.
Yeah, truly is my pleasure. I feel like AmeriCorps is something that is very core to a lot of public health work, and especially over the last couple of years, we've seen how important the workforce engagement part of AmeriCorps has been to public health. So excited to hear more about the insights, as well as hear more about your career journey from psychology to becoming a lawyer to then working more in public policy type stuff. But before we get into any of that, how do you identify and tell us a little about your personal background?
Sure. So again, I'm AJ Pearlman. I have short brown curly hair, and right now I'm wearing an AmeriCorps hoodie, which I think is burgundy. I respond to all pronouns. I present as a female, but do respond to all pronouns. I'm based here in Washington, D.C., where I've been for about 16 years now. Time flies. I think that's going to be a theme of this interview. And I'm from Los Angeles, California originally. So I've been on both coasts with a little bit of time spent in Arizona for school.
Well, I appreciate you sharing that. And just to get into everything, so a recent study by the Double Foundation found that there's a shortage of 80,000 public health workers. Public Health AmeriCorps was launched in 2022 to help address this challenge by giving on-the-ground hands-on experience and training for young people. This innovative partnership between AmeriCorps and CDC bridges national services and public health that has shown many successes. Can you talk more about some of the successes you have seen from this?
Absolutely. So, the interesting thing about Public Health AmeriCorps, which you just noted, is that it's this really innovative partnership between AmeriCorps, which has long-standing connections in communities and has led national service programs for many, many years, and with CDC, that is our nation's leading public health agency and really brings that expertise. So, what Public Health AmeriCorps has done since it launched about a year and a half ago, is really has succeeded in getting people power into communities to address urgent public health needs. So this started out as one way to address the COVID-19 pandemic. But what we've seen is that not only do our public health needs change as we go through time, but also lots of communities are dealing with multiple public health crises at the same time. So, whether it's the opioid epidemic or youth mental health issues or health disparities in maternal and child health, there are many different issues that are facing our communities every day. And what we've seen already is that our Public Health AmeriCorps members are making a difference in their communities day in and day out. And maybe one of the things I'll say about Public Health AmeriCorps members is they are getting this really on the ground experience in the field of public health by doing this year of service. And our members don't need to have any experience before they come to the engagement. So we're pretty excited about this, and we've seen some great early successes.
Yeah, well, thank you for sharing that. And on the public health side of things, I can see how needed and important this is for the workforce and the challenges that we face today. Can you talk about who is an ideal type of person to apply for Public Health AmeriCorps?
Really anyone. What we would say is we are anxious to diversify our future public health workforce, and we know that people come to public health in different ways. I think we'll talk a little bit about my journey into public health a bit later. But we are really looking for individuals who maybe are right out of high school and are not sure what they want to do. And so they're looking to just get a little bit of experience and explore the field of public health through service. Um, there are many individuals who have come to Public Health AmeriCorps in a mid career shift. Or maybe they were interested in going into public health or healthcare earlier in their careers, but life took a pathway that it never expected. And we also have folks who are very much interested in public health. Maybe came to the field through contact tracing when the pandemic hit. Perhaps they are interested in learning more, and maybe they've retired from a first career and are looking to see what the possibilities are now that everyone knows what public health is, since we've all been living through the pandemic over the past several years.
And some of the benefits that are listed on the website around this program are living allowances and the education award, which I think are considerations that are coming up more in people's mind as they are being more intentional in developing their career and choosing the path that they want to lead. Can you talk more about those benefits as well as maybe some others?
Yes, absolutely. So, like I said, to be a part of Public Health AmeriCorps, you don't need to have any prior experience in public health. You just need to be at least 17 years old, and you need to be willing to learn and willing to serve in your community. So what we offer through Public Health AmeriCorps are opportunities in local communities that differ depending on what the needs of your communities are. So some of our positions are part-time, some of our positions are full-time, and again, it depends on which program you are serving through. That being said, all of our Public Health AmeriCorps members do get access to a CDC developed Foundations of Public Health training. So really giving an introduction to the core principles of public health, like health communications, health equity, those things that maybe if you have not previously had any experience in public health, you may want to learn about. We also provide that on the ground experience. You are working at a host site where you receive, projects, and you're interacting with other public health professionals who are doing this work day in and day out. We also have professional development opportunities. So as an example, we do a monthly public health leader speaker series, and this is available online virtually for all our members across the country. And the public health speaker series has really ranged from conversations about climate and health. We've done some mental health and wellness activities. We've introduced folks to individuals who work in the public health career services field to talk a little bit more about the opportunities to serve in public health and to take a career path into public health. So we do offer that speaker series. We do trainings for our members, which topics change based on what the members have requested. And in addition, when you are serving, you do get that living allowance. So this is sort of a stipend that you receive. The amount that an individual receives is dependent upon their program, but just to give you a sense, we provide approximately $28,000 per full-time member, and organizations use that for both the living allowance and to provide additional resources for our members. So just to say, we know that that is not enough. We know that in some parts of the country that is not enough, but we are anxious to reduce any barriers we can and help individuals get access to that public health training that they are looking for. And then finally, while you're serving in Public Health AmeriCorps, we do have student loan forbearance. And at the completion of your service year, you are eligible to receive an education award that can go towards either paying off student loans or to be used for tuition in the future. So this really is about serving your community and about helping with your community's public health needs, but we also want to ensure that our members have a strong member experience, that they're getting what they need and what they deserve out of our program as well.
Thank you for that overview, and I will definitely link the website in the show notes for anyone that is interested in digging in more and trying to learn more. And I'd imagine that there's more places on there to learn more if you did have broader questions. But I appreciate that. So we spoke a little bit about some of the successes. What are some of the ongoing challenges that you're seeing in the field with public health, with AmeriCorps, with the workforce?
I think the biggest challenge that we're seeing, you mentioned it at the beginning, we have 80,000 approximately open positions across the country, or we would need 80,000 more public health workers to be able to provide core public health services across the country. So I think that is our biggest challenge. We have we need a bigger public health workforce, and we also need a more diverse public health workforce that understands the needs of the communities that we as a workforce are serving. So because of that and how we're working on that, we really are looking to bring in individuals from a range of backgrounds who can get that initial experience in Public Health AmeriCorps and then use it as a jumping off point to pursue a career. I would also say, we're not going to change the public health workforce overnight. So this is a bit of a long-term challenge. Working with AmeriCorps and CDC, though, we are using the field of national service and really bringing national service to public health to help us really with this, as we've mentioned before, the innovative solution there. So we're hoping that through thousands of people serving in public health AmeriCorps, that we can both build that next generation of public health leaders and really help improve the pretty strained public health systems that we have now.
And I just highlight that it like provides a solution, or one of the solutions, that is a pathway into learning more about public health as well as getting that initial hands-on experience. So definitely an advocate for that. So once again, the site is linked below.
That's
and
great.
And as we alluded to, AJ, your career has taken very many turns and twists to get you where you are right now, and we'll hear more about that in a bit. But in your career, you've had a lot of experience using policy as a lever to improve health. How did you make this realization of that connection between policy and health?
Well, I hope I'm not getting too far ahead of your questions, but I think my personal story is a little bit, it's important in answering this question. So, when I did go to law school, as you said, although my early background before law school was in the field of mental health. And as I was working in the policy field early on in my legal policy career, it was right around the time that the Affordable Care Act was passed by President Obama and his team. And I didn't know what the Affordable Care Act was going to look like, but what I did know is that I wanted to be engaged in its implementation, and I wanted to be engaged in the process of helping millions of Americans get access to healthcare. I have been lucky enough to have access to healthcare throughout my life, and I do believe that everyone should have access to really high quality care. Regardless of where they live, who they are. And so it was in the early days, this was about 2010, 2011, when I joined the Department of Health and Human Services. And I actually joined not in a policy role, even though I was a lawyer, but in a community education role. So I joined with the intent to support the External Affairs Office. We were talking to healthcare providers, we were talking to community-based organizations, we were talking to what we fondly referred to as real people about the law, the new law, and how it could impact their lives. And it was through that process that I realized that I wasn't seeing my community in the implementation of this law. So I identify as a queer individual. I have a same-sex partner. We had hopes for a family, and I realized that LGBTQ organizations were not showing up in this plan for us as we were reaching out to implement this new law. And it was through just me happening to be in the room where these decisions were being made that I was able to say, hey, can we include LGBTQ people in this outreach and education plan? And so it was kind of through just being there, being in the conversation, being able to say, wait a second, these new policies that are being started up, they have an impact on my life, they have an impact on my health, and how can I make sure that my community is being seen in these conversations and in these decisions that are being made? So it was that initial sort of personal connection where I truly felt it. And I would say I was really able to, not only from me, but also to all of those openly LGBTQ individuals who were working on the new healthcare law, who were working at the Department of Health and Human Services, who were filling these public health roles. It was by us working together that we were able to say, wait a second, there is room for us to ensure that our community is being cared for in these conversations. So that's how I got here. There's much more to that story, but I really do think there's something to bring to bear for our personal connections as well.
That's very, very powerful. And I think it just highlights the intersections of like who we are as lived and the lived experiences that we have and how that operates within this public health work. And just realizing like how important it is to have representation because to your point, if you weren't in that room, someone might not have raised that this was an issue and that this needed policy to be there. And I think that's why it's so important that we as individuals take it upon ourselves to try to get into those rooms where decisions are being made so that we can advocate for those communities that might be overlooked or just invisible in many cases. So I think that that's very important, and I appreciate you sharing that.
Sure. And let me just give you a couple of examples because I think it's helpful for folks to hear. When I started working at the Department of Health and Human Services, I couldn't have visited my spouse in the hospital if she had gotten sick, and I couldn't have made emergency medical decisions for her. So we worked together to make sure that hospital visitation was a reality for all families. And this was before the Supreme Court legalized same sex marriage. Um, the other thing that is tied pretty directly to the Affordable Care Act is that the Affordable Care Act prohibited, not allowing people to get access to health insurance if they had a pre-existing condition. And at that point in time, a lot of insurance companies said that being transgender was a pre-existing condition. So many trans people had no access to health insurance solely based on the fact that their identity was considered a pre-existing condition. So through those conversations, we were able to say, you are not a pre-existing condition. And we were able to work with the LGBT community broadly, but the trans community as well, to help get access to health insurance. So you see these connections between policy and between individual healthcare outcomes that have a pretty powerful effect. So just wanted to share that.
Yeah, and I think that even highlights the point of the structural inequities that are embedded into some of the institutions that we have and like why it's so important for us, once again, to advocate for the things that are important. And not everyone is going to have the opportunity to be in a room talking about the Affordable Care Act, but I think it's still important for all of us to have a role in advocacy and like just speaking up on the issues that matter to us and to our communities. So, how can we as public health professionals, students, advocate for more policy solutions?
I think it really comes down to showing up. I think it comes to showing up as yourself and to pushing for what your community needs, but also realizing that we have intersections with all sorts of communities. And so, as we are lifting up our own challenges and lifting up our own issues, how are we also thinking about how we can support other members of our community who may be different than us? So, I think that's really important. I think telling our stories is incredibly important, and making those connections is so valuable to helping to improve our public health system as a whole. So it really is those stories. It is using our voices. It is a tool that we have, and I think that we should take advantage of that.
Absolutely. Before we get more into your collegiate journey and the things that you've done to get to where you are, what does public health mean to you? Before we get back to the show, are you feeling unsure of your future career path? Feel like you're forever balancing competing priorities? Struggle to stay up to date with emerging public health trends? Or want to develop skills for upskilling your professional development? Well, you're not alone. Come join our public health friends and get early access to be part of our community, an authentic space to share as a public health professional, create meaningful friendships, collaborate on various projects, and share valuable resources and insights. Early access to becoming a founding member will be starting on Valentine's Day. Early access gives you the largest discount on the community, so hit that link below to join the waitlist. I look forward to having you and building this community alongside you. Enjoy the rest of the episode.
People say that public health is doing its job if no one hears about it. And I I struggle with that comment quite a bit because I think it's important for us to show what public health is doing every day. Public health is community health. What does that mean to me? It means how are we taking care of our communities, and how are we working together to make sure that everyone has access to a healthy and happy life. So that's what public health is. And I would say that the more that we can have an impact on our communities as a whole, the more that our individual lives will be changed. And so that's why that's what public health is to me. And that's why I focus on this as my life's work.
Very, very important. And I think that's one of the downfalls of public health is not being able to promote or market ourselves when things are going right. But I think like another shout out to AmeriCorp program, AmeriCorp public health program is just like how this has the potential to bring these kinds of careers and to the community and like create those narratives where people understand what the importance of this is to their community and how they can really advocate for better health. So you got your Bachelors of Psychology at the University of California, Los Angeles. Tell me about that thought process.
That was many years ago. Yeah, so I did go to UCLA for my bachelor's degree. I will tell you, I started out as a chemical engineering major, took one chemistry class, and decided it was not for me, and quickly changed my major to psychology. So the why I say that is because I feel like it's okay to change your mind. It's okay to shift directions. And for me, psychology was interesting. I didn't, both in chemical engineering and in psychology, I didn't really have a sense of what I was going to do with my career, but I knew that psychology was a topic that I was interested in learning about. And it was something that got me excited about studying and going to class. And so that's how I ended up um, uh, pursuing a degree in psychology. It also, I think, has had an incredible impact on where my career has gone and how it has gone. So this is maybe getting a little bit ahead, but I was able to do a number of internships as part of my psychology degree. These were all unpaid at the time, unfortunately. So I also had another job, a paid job. But it was through those internships in psychology related programs that I learned so much about human behavior. I learned about how we can improve our health, specifically mental health. And that has been a through line in my journey, in my career journey. And I am so thrilled that I pursued something, even though maybe it wasn't a particularly clear career path at the time. It was something that interested me and that I gained a lot out of. So who knows where I'd be if I was a chemical engineer today? Probably not happy, that's for sure.
And the happiness is very important as well. And yeah, I feel like that is a very common theme. It is that you go into your undergrad degree doing one thing, you come out with another degree and just a newfound knowledge and experience for what you could really do, and especially like affect around health, because I think there are many opportunities and jobs that we just don't know about until we actually figure it or expose or have those experiences to kind of learn about them. So did you have any specific research work that you did during your undergrad that really stood out to you and that you wanted to share with us?
Sure. So I actually worked in, my minor was in developmental psychology, applied developmental psychology. So I worked a bunch with kids. And what I would say is one of my internships while I was in college was at UCLA's Childhood OCD, Anxiety, and Tic Disorders program, where we were both treating kids with those disorders, and we were doing research at the same time. So it was that balance between individual health care, mental health care, and broader impacts to our community's health. So to me, that was just such a valuable experience. I did end up getting hired by the program right after I graduated. And I just say that because we talk a lot about how our Public Health AmeriCorps members can use this experience to not only get that, training and build those skills during their year of public health AmeriCorps, but also they can make connections with the people who are working in the field. And that's exactly what I did. And that's how I got my first job out of college. Was I made those connections, I learned a ton, and I was anxious to continue doing the work. So I was lucky enough to make that move, and there was an opening, and it paved my career path for the next 3 years or so. I was able to understand the needs of kids. I was able to see how mental health issues have a real effect on your ability to succeed in school. And through a little bit of a conversation with myself over those 3 years, that's honestly what led me to pursue law school.
And we will get more into that thought process in a second. But before we get there, what were any of your undergrad takeaways that you had?
My biggest, it was now more than 20 years ago, but my biggest undergrad takeaway was learn as much as you can and take as many opportunities to pursue internships, because that experience will just help you better understand what you like and what you don't like. And it'll help you focus your efforts once you know more about what it is you're interested in.
And like AJ, you might end up with a job right after you graduate as well because of that internship. And I think to the other point is like just building your network and getting that professional experience is very, very important. So you graduated from UCLA, you started working, well, continued to work from your internship into a full-time job, and you were doing work around child development, mental health. What was that push for you to go on and decide to pursue a law degree? Tell us more about that thought process.
So most people who work in the, sort of as a research coordinator, as a research assistant in some of these academic based research centers in mental health, most go on to pursue a PhD in clinical psychology. They do treatment, they do research, they go into academia. And one thing, as I interacted with all of these children, we were treating them and we were treating their mental health needs, but they were still struggling in school. And to me, what I saw was a really big challenge was there was no one to advocate for kids in schools who were struggling with anxiety, who were struggling with OCD, who may have had Tourette syndrome. And I went to law school with the intent to become an advocate for kids with disabilities in schools. That was my shift. I said, wait a second, I don't want to do just, therapy for one kid at a time. And I had my experience in research, and it wasn't something that I wanted to dedicate my life to. I wanted to figure out, how could I help as many kids as possible, and how can we help these kids have healthy lives? And so that was my reason for going to law school, was really to become that sort of advocate and be able to impact the lives of many kids.
I love that. And I think it operationalizes, like, get in the field, do the work, and then from there you kind of realize or you see what are the systemic or the policy barriers that are kind of coming up, and you think about how can I approach this work from not like a 1-to-1 ratio, but how can I impact change at that community or population level. So I love that. So you got your law degree at Sandra Day O'Connor College of Law at Arizona State University. During your time there, you had quite a few legal internships. I'll list them out and then you can go through them. So you were at the Arizona Center for Disability Law. You were at the Arizona State Legislature Democratic staff. You were a National Gay and Lesbian Task Force member for Representative Harry Mitchell in the U.S. House of Representatives. So tell us about those experiences.
I said for undergrad, internships were important, and I sort of took that with me into law school. Um, there are people who go to law school with the intent to, get straight A's and be on the law journal and get a job at a big law firm. I knew that I didn't want to do that. I knew that wasn't the path that I wanted to pursue, but I wasn't quite sure which path I did want to pursue. So I worked at ACDL, I worked in the state legislature. I was just I worked for the task force. I was looking to explore different ways to use a law degree and to be able to, again, have that impact on community. And for me at the Center for Disability Law, that was a litigation advocacy organization. I worked on an amicus brief at the Arizona State Legislature. I saw state government and the passage of laws happening in real life. At the National Gay and Lesbian Task Force, I worked on drafting legislation for local and state legislatures around employment discrimination. We worked on trainings for homeless shelters. And really, I had the opportunity to sort of see what it's like to work as a civil rights advocate. So for me, it was about exploring these different areas of how the law impacts different careers. And what I'd say is, while I was at the task force, the folks I worked with took me to meetings with staff on Capitol Hill. They took me to briefings. They showed me what it's like to work in the field of advocacy. That led me to be interested in working on Capitol Hill, which led me to the internship with Representative Mitchell. So there is a through line. But what I would say is law school for me, again, was all about learning. And the biggest thing I took away was, if you work in government, you can actually solve problems before they happen. You can help communities before they happen. You can make change that will improve people's lives. And that's sort of how law school to me was an education in how government works, and a realization that a career in government can have an incredible impact on my community and on all communities. So that's what I took away from all of those different experiences wrapped into one.
Yeah, pivotal takeaway. And I think important in understanding how we can make like big changes, and understanding that every organization has its role to play, but different organizations have like different leverage points in the work that they're able to do at a point in time. And you kind of spoke to your biggest takeaway already from law school. So after law school, you worked as a policy fellow at the National Center for Transgender Equality, the state policy attorney at Break the Cycle, and Health Resources and Services Administration, External Affairs. At the Health Resources and Services Administration, you were an external affairs specialist and then a policy advisor. Can you talk more about those experiences?
I can. And let me just say, I joke a little bit that I can't hold down a job. I think I've been the longest time I've been at a job is about 3.5 years. But what it really comes down to for me is seeing where there's opportunity and not being afraid to walk through a new door. It's always a little bit risky. Sometimes it works, sometimes it doesn't. But for me, it's where can I have an impact and where can I continue learning? And many of these opportunities really were about both my own learning, but me being able to contribute to our needs. So for just the fellowship that I did at NCTE, I helped NCTE draft this was right as the Obama administration was getting up and running, and we drafted a federal policy agenda that was then used by the organization long after I left to work with the Obama administration in all sorts of, whether it was changing identity documents and allowing folks to change their gender on their passport, to making sure that folks can get access to gender affirming care, or that they can get through any number of government processes being respected for who they are. So that was an experience for me. It was drafting a document that straight out of law school. I sort of worked on a federal policy document. It was a pretty cool experience, and one that allowed me to work not only with the folks at NCTE, but with other partner organizations. And I saw the real importance of collaboration in that effort as well. Similarly, when I worked at Break the Cycle as a policy attorney, I was working on teen dating violence and helping state and local organizations, support individuals who may have experienced teen dating violence, training high school students around how to have healthy relationships. And again, it all came down to trying to make those change, trying to stop problems before they occurred. In some of that work at Break the Cycle, I was engaged with partner organizations around reauthorization of the Violence Against Women Act. So again, some of that legislative work that I had done previously, some of the information that I had learned during law school around how to work within and with government continue to shine through there as well. So it's again winding road, but it comes down to where can I be helpful and how can I help communities, and so that's where I am.
Yeah, and going back to what you said earlier, you said that you may look like someone that shifts around in jobs a lot, but that's really because you're looking for opportunities for impact and learning. How would you advise someone as they're taking on their career to think about that and like thinking about how is that next opportunity or the opportunity I'm seeing there? Is that something that is impactful and I would learn enough to validate me making that shift?
Mhm. I think I would say two things. First of all, um, figure out keep your eyes open. Figure out where there are gaps that you can see. Are there things at your current job or in your current role that you think can be done differently, or can you start a new project, or can you engage with a new coworker to start something new? I think there are opportunities to learn in that, and that is seen as leadership, and that also helps you build leadership skills as well. So I think that's something that I have seen play out in my career. And then the other thing I would say is don't be afraid to jump. We no longer live in a world where people have the same job for 30 years. We also honestly don't see folks move from a, bottom rung of an organization, a company, et cetera, up to becoming CEO. We see folks moving to get those different experiences. And I would say with both myself and with people that I work with, those different roles give you different perspective and bring different experiences to every job that you take. And I think that is incredibly value in today, in this day and age.
Insightful. Thank you for sharing that. And then you moved on to become the Associate Director for Policy for Let's Move at the Office of the First Lady at the White House. How did you get involved in this, and tell us more about that work?
So I had mentioned earlier that I jumped to the Department of Health and Human Services when the Affordable Care Act passed. I was doing some of that community outreach and education around the law. And I was engaged with many different types of community organizations that were focused on improving health. But again, as I have said all along, I've always been interested in kids. I've always been focused on thinking about how people can lead healthy lives. And the work that Mrs. Obama was doing with Let's Move just felt so near and dear to my heart. I've always been, just in my own life, focused on health and physical activity and nutrition. And this was a real opportunity for my personal and professional to coexist for a little while. So I heard about this opportunity from a former coworker of mine, actually a former supervisor at one of my internships, and I applied. And I was able to take the experience that I had working at the Department of Health and Human Services, doing some of that community outreach and education, and translate it to doing a similar effort at Let's Move. So what I did in that role while I was at the White House was really work across the federal government agencies, Health and Human Services, the USDA. We even worked with the Interior Department and the Bureau of Indian Affairs, and we worked with the Institute of Museums and Library Sciences. I was really there to both lift up the work that those federal agencies were doing around nutrition, kids' nutrition and physical activity, as well as making sure that all of our federal agency partners had the information they needed from the White House to be able to implement the administration's priorities. So again, that crash course and knowing how government works in law school played out in that role, as well as the importance of collaboration that I mentioned earlier. Mrs. Obama could not have done Let's Move without all of those agencies, and the work that all of the agencies did really were lifted up with Mrs. Obama as a key messenger for the importance of the work that our federal government agencies do every day.
Yeah, well, thanks for lifting that up. And that's awesome work. And it's always exciting when you get to coincide in a space between your personal and professional domains of like happiness and expertise and stuff. So that's
So
cool.
true. Yeah.
And can you tell us a little bit more about, so you spoke about it earlier on around your work at the U.S. Department of Health and Human Services during the Affordable Care Act. You were Senior Advisor, Division of Home Visiting and Early Childhood Services, and you spoke more about community education. Were there any other parts of this role that you wanted to share? Oh, and you were also the Chief of Staff and Senior Advisor for the Office for Civil Rights.
So over about a period of 6.5 years, I was in 4 different positions at the Department of Health and Human Services. And so I was moving from place to place, but it was all within the realm of HHS. And I was able to take the connections that I made in one office and then be able to build upon those connections as I moved to the next place where I was working. So home visiting was another big effort and priority of the Biden administration, and I worked with that division to lift up the work that home visiting was doing to help the director there really bring to bear the important work that we do for kids age 0 to 3 and pregnant individuals and parents. And so again, this all ties back to being able to lift up communities, being able to lift up our most underserved communities, because many of our home visiting and early childhood programs do support communities that are underserved. So again, just trying to push that ball forward and continue the great work. Similarly, at the Office for Civil Rights, I was still working on the Affordable Care Act. We put out the first the big regulation around non-discrimination in healthcare, really making sure that people could have access to healthcare. And it was a big support for, as I said, LGBTQ communities to update the language around what sex discrimination in healthcare looks like and how we can continue to support all of our communities. So again, it was moving around a bit, but I learned so much from going from working in community outreach and education to supporting a director, and then moving into a leadership role in the Office for Civil Rights. I would say as chief of staff there, that was really my first leadership role, and being able to work with the director of the Office for Civil Rights was of incredible value to me in my own leadership journey.
And can you quickly touch on how you all got feedback on the regulation against non-discrimination in healthcare from LGBTQ plus populations? What was that process look like?
Sure. So just like every notice of proposed rulemaking, we release this. First of all, there is lots of input that happens internally across the government, across HHS and other interested agencies like the Department of Justice and others. So that happens through the regular government rulemaking process, and then there were opportunities for individuals, organizations, and others to write in, providing comment. I think it was a 60 or 90-day comment period for anyone who wanted to provide input into the proposed regulation before that final regulation was implemented. So, again, all of us can have impact on what our federal government does. And I saw that process from within the Office for Civil Rights quite clearly.
I almost left this position off from the interview, but I actually did a KABOOM build like 2 or 3 weeks ago and was it was an enjoyable time. So I didn't want to leave it out. So you are the KABOOM, you're the Director of City Partnerships and then the Senior Director for City Partnerships. Maybe tell us a little bit about what KABOOM is and then tell us about what you did in those positions.
Sure. So the short version is KABOOM is a national nonprofit organization that has worked for decades across the country building playgrounds in underserved communities. That's one version of KABOOM. That is what KABOOM does. But KABOOM really is focused on play equity. KABOOM is really about who has access to play, who lives in communities where it's safe to play, and who gets the coolest play equipment. I don't know that that's KABOOM's formal messaging there, but I would say when I joined KABOOM, there was really a focus of moving from one playground at a time to how can we have an impact on communities at a larger scale. So I joined as the first director of city partnerships, and it was my role to build sort of public-private partnerships with local municipal organizations. And just to give you one example, we formalized a partnership with Baltimore City Public Schools where instead of building one playground at a time, we worked with them at scale to do a full assessment of the playground needs across the entire Baltimore City school system. And then that first year, I think we built 6 playgrounds together through that partnership, and that partnership continues to exist to this day. So it was really a great opportunity to help KABOOM rethink its one playground at a time model and to shift toward larger community impact. It was very exciting, and if anyone has an opportunity to do a playground build with KABOOM, it's pretty cool to see a playground go from flat ground to a whole structure put together in about less than 6 hours. I hope you had a good time, Omari.
I had a good time. To put me on the hardest thing, the hand sanitizer station. But you wouldn't imagine how many people it took to fix and make a hand sanitizer station. But we did it. We did it.
That's
It was
great.
fun.
Very
Yeah,
important.
right. Well, and what I also like about KABOOM is just how they come into the community and they ask them for the design ideas and they bring the children in to share like what they want in their playground. And then I think the other cool thing about it is just realizing if you can create this one cool playground in one day, what is the impact that you can do as a community when you come together in the long run? And I think that effect, as well as people just being very happy to have a play space. But I thoroughly enjoyed that. So thank you for sharing that.
And the play space, I mean, those kids' smiles when they first get to run onto their new playground is amazing. But I think we also have to remember that play spaces are not just for the kids. There are places for parents to gather. They are places for social connection and community that are incredibly important, especially in this day and age where we have somewhat more limited opportunities. So just from it's great for kids for physical activity, but I also think it's a mental health boost for parents, for caregivers, and for other community members as well.
Yeah, it actually acts as a community hub in many, especially rural spaces, and I guess urban as well. But yeah, it provides a lot of opportunity.
Absolutely.
And moving on to your next role, you are the health lead personnel appointments team for the Biden-Harris transitional team. So tell us what that means, and then what do you do in that role?
So one of the things that as I said, I first did at KABOOM was really start up something new. And I really enjoyed the challenge of building something from the ground up. This was, like I said, the first time KABOOM had this thought, um, and when I was reached out to by the Biden-Harris transition team around helping with doing some of the hiring for what would hopefully be a Biden-Harris administration, I saw it as a real opportunity to do two things. First of all, to impact and to help the incoming administration, but second of all, to be able to hire, to identify, interview, and hire a really diverse set of incoming appointees for the administration. So for me, it was about my own interest in and challenge in helping the Department of Health and Human Services and a handful of other federal agencies with their hiring at the beginning of the new administration. But again, it was also about knowing how lucky I was to have been in the room in the early days of the Affordable Care Act. What could I do? Because there are so many experienced, talented people out there whose lived experience is so incredibly incredibly valuable to how we make policy, that I wanted to um, be able to, bring those people in and have a conversation with them first of all, but then also be able to hire them. So it was a great opportunity on that front for me. Also, just to be able to see the changes that have been made since those folks have been hired has been really exciting to watch as well.
Yeah, and going back to talking about representation, as well as like having your voice or using the voice that you have in rooms to really advocate for the things that are important to you. And I think diversity is something that should be important to all of us, so that we're ensuring that we're getting people who have lived experiences from all communities represented and share their solutions. And then after this role, you're the chief of staff for the COVID-19 response. So tell us about getting into that role, and then what did you do in that role?
Sure. And for anyone who's watching, we're almost through. No. So again, as we were working to build the team for the incoming administration, that was late 2020, early 2021. COVID-19 was one of the biggest public health issues, the biggest public health issue we were dealing with as a country, as a world. And there were some shifts that were happening to be able to better address COVID within our country, and I wanted to be engaged in trying to make some of those changes, trying to address the severe impacts that COVID was having on our communities. And so I was lucky enough to be selected for this role to be the chief of staff to the COVID-19 response team at the Department of Health and Human Services. And I was able to help our then counselor and now head of the Administration for Strategic Preparedness and Response, Don O'Connell, build a team that was going to work closely with the White House to lead the efforts to address the pandemic. And so it was through this role, honestly, it's a little bit of a blur because we were working so hard to address all of the issues that were coming out of COVID, whether it was getting testing sites set up or getting vaccines out across the country, getting tests distributed to folks, addressing surges in certain parts of the country, or working with CDC as they dealt with the public health issues on the ground. again, it was a little bit of everything, but I truly believe that it was because of the work that we did there that we are in a spot now where the public health emergency has ended. I can't say that COVID is over, because we all know it is definitely not over, but there has definitely been a shift from where we were at the beginning of 2021 to where we are now at the end of 2023.
Yeah, absolutely. A lot has happened. I cannot imagine the work that you all had to do during that period of time, but thank you all so much. I think it's very, very important. And too often we forget to say thank you and appreciate those that are working hard, and many times are the people that are behind the scenes that we don't get to appreciate. So shout out to you. Big kudos. We appreciate you doing that work.
Absolutely.
Before we get back to the show, are you feeling unsure of your future career path? Feel like you're forever balancing competing priorities? Struggle to stay up to date with emerging public health trends? Or want to develop skills for upskilling your professional development? Well, you're not alone. Come join our public health friends and get early access to be part of our community, an authentic space to share as a public health professional, create meaningful friendships, collaborate on various projects, and share valuable resources and insights. Early access to becoming a founding member will be starting on Valentine's Day. Early access gives you the largest discount on the community, so hit that link below to join the waitlist. I look forward to having you and building this community alongside you. Enjoy the rest of the episode. I guess before we move on to your current role as Director of the Public Health AmeriCorps, you've had a very extensive journey in public health, having various roles, affecting change at various different places. Like, just broadly speaking, when people are thinking about their public health career and how they should be thinking about navigating it, like, do you have any advice or any frameworks that you use that someone else can think about when they're approaching their career?
Sure. So, first of all, my career has not been linear. In some ways, public health is not linear. And I think that it's important to remember that. I also think there are many different ways in which you can have an impact on public health, whether that's working for a local health department, or working at a community based organization, or serving as a community health worker, or engaging in HIV and STI testing, or volunteering at your local food bank, working to address nutrition insecurity. So just thinking about the breadth of public health, I think if there's one thing that I have taken away from this, it's that we all have a role to play and we can all contribute. And it doesn't there's no one better pathway into a career in public health, and there's no one career in public health. We need folks all over working on many different issues, and I think that that's one thing we saw our AmeriCorps members do during COVID. None of our AmeriCorps members were planning to jump in and work on COVID when they started their service, but when the pandemic hit, we saw AmeriCorps members jump in, take meals to folks who maybe couldn't leave their house. We saw members doing wellness checks. We saw members, getting PPE where it needed to be, or staffing those testing sites. So just I would say, there are many different opportunities, and I would encourage folks to pursue what is most interesting and exciting to them, because that's where you're going to make the biggest difference.
And we heard a lot about some of the successes that Public Health America have. You're the director. What are the things that you do on like a day to day, week to week? What does your role entail specifically?
Yeah, so let me just say before I answer that question that when I heard about Public Health AmeriCorps, I was so excited about this new partnership that really was in its infancy when I heard about it. And this was mid 2022. We had definitely turned a corner with COVID. And what if I learned anything from my role on the COVID-19 response team, it was that our public health workforce was overworked, was being harassed in ways we had never seen or experienced before. And there was just such a need to bolster both our public health infrastructure and our public health workforce. So when I heard about how Public Health AmeriCorps was getting up and running to really bring together public health and national service, I was so excited about the opportunity to serve in this role. And it also brought a little bit of my personal interest in building leaders of the future and mentoring and coaching, which I've done informally throughout my career, really to bring that to the fore and to bring it to scale. So in that year and a half, we have now more than 3,600 Public Health AmeriCorps members serving all across the country. I think it's something like 900 sites all across the country. And we are seeing those 3,600 Public Health AmeriCorps members make change in their communities every day. So what do I do on a day-to-day basis? Every day looks different. I am really here to make sure that our members have a great experience, that the organizations that the members work with feel supported, that we're getting good, helpful public health content and professional development opportunities out to our members. And that looks different every day. Sometimes it's doing podcasts like this, talking to wonderful folks like you. Other times it's we took 30 members to the American Public Health Association conference where they had the opportunity to do a poster presentation about their service and different projects that they have done on their service, or through their service. So the days look different. So a couple weeks ago, I was making copies of agendas and buying materials at Staples for our, for our grantee convening. So we're a small team here at Public Health AmeriCorps, but we're just out there to support our members and hopefully, again, build that next generation of leaders.
What do you enjoy most in your role?
The energy and creativity and excitement and passion of our members. I cannot tell you how much I enjoy talking to members themselves and seeing them in action, seeing their work, seeing how excited they are to be doing the work that they are doing. I had one member who was working here in the DC area with the Latin American Youth Center. He told me that he thought public health was really all about sitting behind a desk all day. And when he learned more about the fact that public health includes things like food inspectors and he could be out on the road every day, it really changed his view of who he's, of what his career pathway may be. We have a member who served in Tucson, Arizona. His name is Jaden. He is a son of immigrants. He has been interested in policy. He wants to go to law school. He served with the local health department in Tucson and was able to really help them think through their policies and regulations and do work that perhaps may not have been prioritized if there wasn't a Public Health AmeriCorps member to help. And then the last just example I'll give you, we have a member named Dion, and she's been serving in the city of Rochester. She lost a family member from COVID, and it was through that personal experience with losing that family member that has made her realize that she wants to help Black and Brown communities be healthier. And the coolest thing is that I believe she's gotten a job since completing her Public Health AmeriCorps service to continue serving in public health. So if you can't tell by my sharing of their stories, that is what is so exciting for me. It really, really gives me hope, and it motivates me to keep going every day.
Love that. And we love to hear the stories, so keep them coming. And I hope that you'll are sharing those and capturing those to share more broadly as well.
I have 3,600 of them, so just let me know when you have more time.
Awesome, awesome. So before I move you on to the Furious Five, I would like to ask, where can people connect with you, and where would you like to see yourself in the future?
Sure. So you can connect with me personally on linkedin.com/AJ Pearlman. That's the best place to connect with me. But I would really encourage folks, if you're interested in learning more about Public Health AmeriCorps, to go to americorps.gov/public health. We have opportunities to serve in almost every state and in Guam and Puerto Rico. So if you're looking for opportunities to serve, we would be thrilled for you to explore. So AmeriCorps.gov/public health, and we'd be happy to share more about the program with you.
Awesome. And where would you like to see yourself in the future?
I am doing what I love right now. So who knows where I'll be in the future? But right now, being able to do this work is really where I want to be, and I hope that I have the opportunity to continue doing it well into the future.
Well, we are all hoping the best for you.
Thank you.
You're most welcome. So moving on to the Furious Five, the 5 questions that we ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Do what you love, first of all. Like I said before, public health is such a broad field that there's something for everyone. So I would encourage you to try out different opportunities to see what works for you. And when you find something you love, go for it.
Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Don't be afraid to reach out. I think that people are always willing to talk to you. I know I'm always willing to talk to folks who are interested in public health, who are interested in AmeriCorps. And I have been surprised throughout my career how much people are willing to take the time for me. And I want to do that in return and sort of pay it forward. So don't be afraid to reach out.
Number 3, what's something you are working on improving in your life right now?
Self-care. Self-care. I think we in the public health field take care of everyone else. And I think it's incredibly important that we also, as folks say, put your oxygen mask on first. So I am the parent of little kids. I run this national program, and I am trying hard to make time for me and for exercise and the other things that I need as well.
Love it, love it. Number 4, professionally, do you recommend anything?
I recommend learning and continuing to learn. I am a lifelong learner. That looks like, I know that looks like different things for different people. I do a lot of audiobook listening, and I would encourage you to find what works for you to continue learning and latch onto it and just allow yourself that chance to continue learning and to continue improving your own set of knowledge.
And are there any books that stand out to you that you want to share? And if you can't remember now, we can always come back to it later.
Only because I just finished reading it. This is definitely public health and maybe public health adjacent. I just finished reading The Radium Girls by Kate Moore, which I would highly recommend as both a sort of historical biography and just a really interesting women's rights story, and a great way to see how public health and health has had an impact on many people's lives.
Well, thank you. And I'll be sure to put that in the show notes for anyone that's interested.
Great.
And then number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I think it would be don't stress out so much. It's all going to work itself out. You're going to find a path that works for you. It may take some fits and starts along the way, but you'll get there. And I think we're all still getting there, but it really is about the journey, not the destination. So enjoy it while it's happening. Don't stress out about where you're going to be next.
Thank you so much, AJ, for coming on and sharing your journey and expertise and all the things that have led you to where you are right now. I enjoyed the conversation a lot.
Omari, thanks so much for having me. I really appreciate it. And if folks want to learn more and get involved in Public Health AmeriCorps, we'd be thrilled for them to do so.
Awesome.
All right.
Housekeeping items, everyone. Thank you all so much for watching or listening to this. If you reached this far, be sure to review and share this with a friend. Greatly appreciated. It helps for sure get out to more people. Have a good rest of your week, everyone. Peace.